Welcome to Born Unstoppable. In this podcast, I have the pleasure of speaking with Dr. Terry Wahls, who is a clinical professor of medicine at the University of Iowa. She defied the odds by reversing her progressive multiple sclerosis through dietary and lifestyle changes. Her groundbreaking approach is known as the Wahls Protocol. In this episode, Dr. Wahls shares her inspiring journey from wheelchair-bound to regaining her ability to walk. She delves into the science behind the Wahls Protocol, emphasizing the power of nutrient-dense foods and paleo-inspired diet to combat inflammation and promoting healing. Dr. Wahls is the author of the Wahls Protocol, How I Beat Progressive MS Using Paleo Principles in Functional Medicine, and her accompanying cookbook, The Wahls Protocol, Cooking for Life. Enjoy the episode. Before we begin, I'd like to emphasize that this podcast is separate from my role as a family medicine resident at the University of Toronto at the Royal Victoria Hospital in Barrie, and I may cover topics that aren't fully aligned with the CPSO, our governing body of physicians here in Ontario. It is, however, part of my desire to bring awareness and information as it relates to improving health and other aspects of life at a zero cost to the general. Hi, Dr. Terry Wahls. Welcome to Born Unstoppable podcast. Thank you so much for coming on.
Well, thank you for having me.
Yeah, it's going to be great to pick your brain a little bit and hear your story. I think one place that we can start is, I know that a big part of your story is multiple sclerosis and how you were able to put that into remission. And so could you please start off by just describing for the listeners what MS is?
Sure.
And typically kind of like the different stages that it can go through. And then how did you go about discovering how to reverse it for yourself?
Yeah. So multiple sclerosis is really the most common neurologic disease that people will encounter. The pathology is that the immune system is overly active, and it leads to destruction in the central nervous systems. That means the brain, spinal cord, and cranial nerves. And depending on the location of the damage, people will have a variety of symptoms, which might be sensory, so abnormal sensations. It may mean decreased vision. It may mean abnormal motor signs, so stumbling, poor coordination, falling. And often people have symptoms for years that are not really well understood. And then finally, there's enough damage that a diagnosis can be made. The most common age for diagnosis is in the 20s or 30s. It's unusual to have this be diagnosed later in the 40s. It is a slowly progressive disease. At first, in the 20s and 30s, you might have an episode, a relapse where you have more symptoms that gradually improve, so it waxes and wanes. By the time you're age 40, 45, there's fewer relapses, and instead there's a slow, steady progression of loss of function. Ultimately, people typically have loss of motor function, difficulty walking. You may have difficulty with mental clarity. You may have more problems with anxiety, depression. And by the time you're 45 to 55, you have this progressive loss of function. It's probably the most common cause of early disability, early nursing home care, early loss of employment.
Okay. And how did you discover that you had multiple sclerosis, and what was your journey to reversing that?
During medical school, I had these episodes of discomfort about my temple, either on the right side or the left side. It was more likely to occur if I was sleep deprived under severe stress. I would have discomfort for a couple of days. Then it would become more intense, more electrical. The durations of the pain would go from a couple days to several weeks. Then eventually, it was troublesome enough that I went to see a physician. I started seeing neurology, and ended up in pain clinic. And I was diagnosed at first with occipital neuralgia, then with trigeminal neuralgia, and it's really like a very intense electrical pain. That a few years later, actually several years later, I'd had a episode of transient dim vision. That um, was occurred on a hot August day. I was out rollerblading after work, and I was basically blind in my left eye, transiently. Saw
Yeah.
neurology, saw ophthalmology, and the conclusion was, don't work out in such hot weather.
Oh
Okay.
no.
And so I had to quit racing in really hot weather. Then 13 years later, on
Wow.
another hot August day, I'm out rollerblading, and I again have a weakness in my left leg, and I see my and it resolved, but the weakness was really quite remarkable. So I end up seeing a neurologist again, and I actually had forgotten about that episode of weakness in my or episode of dim vision. And he did a big workup, MRIs, spinal tap, uh, um, nerve conduction velocities, and we found a lesion in my spinal cord and a lesion in my brain. He said you have relapsing remitting multiple sclerosis, and that episode of dim vision was probably optic neuritis. And he did not relate the trigeminal neuralgia to my MS. He said no, separate disease states. I did some research, found what I thought was the best MS center here in the United States, and I saw what I thought was their best physician, and I started on Copaxone at that time. So that was 2000, and at that time there were interferons and Copaxone. And one of the consequences of interferons is they increase your risk of depression. And I knew that I'd had struggles with depression since I was an adolescent. So I was like, no, I can't take that drug. I can't make my depression worse. So I started Copaxone. And I had one more relapse, a transient weakness in my right hand, which lasted for a couple weeks and then resolved. So from a medical perspective, having no relapses, this would be a huge success, right?
Mm-hmm.
But the problem was, I could see that I was getting relentlessly worse.
Okay.
That I couldn't run anymore. Um, my endurance, for my athletic endurance, uh, remarkably declined. And so I was like, okay, this is really looking a lot more like progressive MS. And then, it was harder and harder to walk. And then I'm needing 2 walking sticks, and my physician says, okay, we should really try mitochondrial form of chemotherapy, in that you really have converted to secondary progressive MS. So, I believe, very much in the latest medicine. So I'm like, okay, I'll do the Copaxone. Pardon me, I'll do the mitochondrial. I had neutropenia. Fortunately, did not have neutropenic fevers. But and I sort of laughed, said, "Well, I guess I'm getting a lot of effect for my drug." And but I still was going relentlessly downhill. So my physician said, "No, Terry, it doesn't make any sense to keep you on this because you're just having side effects without much benefit." And about that time, uh, Tysabri was finally available, and so I took Tysabri, which is the new biologic agent. I was thrilled to take it, but that also didn't help. I was going relentlessly downhill, and then Tysabri was pulled because people were having PML and some serious adverse events from Tysabri. So then that was pulled, and I was placed on Cellcept, which is a drug that is given to people who are on transplants medicine. And I'm in the tilt recline wheelchair. It's getting harder to sit up, and I'm asking myself a really important question. It's sort of interesting because when I was first diagnosed, I did what many physicians did. I went back, I started reading the literature, and I saw that it's a progressive disease, and that within 3 years, the time to job loss on average is 3 years. And so I was just getting more and more upset, more agitated, and my spouse said, "Terry, you got to stop reading the literature. You're just getting yourself so upset. You just got to let your physicians take care of you and stop this." So I had stopped reading the literature shortly after diagnosis because it was so upsetting. But now I know how bad it's going to be. I'm in the tilt recline wheelchair. I can't do any of my athletic stuff anymore. Fortunately, I am still working out every day. Although my workouts are getting smaller and smaller and smaller and smaller and smaller and smaller. It's interesting. My physicians do not send me to physical therapy, but I'm a physician, so I send myself to physical therapy. But I keep doing smaller and smaller workouts, and I finally decided, I know how bad this is going to be, and that's really terrible. I'm going back to reading the basic science. And because I'm asking, am I really doing all that I can? So I am reading the basic science about animal models of MS, Parkinson's, Alzheimer's, because my interpretation is I have a progressive neurologic disease. It's not really looking like relapsing remitting MS. This is all about a progressive disease with a shrinking brain, shrinking spinal cord. And I decide that the common theme is mitochondrial dysfunction. So I start working on creating a supplement cocktail to support my mitochondria. It's sort of interesting.
On the research that you're reading.
Pardon?
Was that the supplement cocktail that you developed or put together? Was that based off of the basic research that you were
Right.
reading?
It was based off of what you could do to support mitochondria, and it had more to do with Parkinson's primarily. Was the stuff that I was finding, and so it was neuroprotection based on animal models for Parkinson's. So creatine, carnitine, lipoic acid, B vitamins, coenzyme Q. After about 6 months of this, my rational internal medicine doc said, "You're just making expensive urine." And so I stopped everything. And the next day was okay. The day after, I just couldn't get out of bed. And, I was just even more exhausted. And then the next day, more exhausted. And on the third day, my spouse says, "Honey, why don't you take these again?" So I did. And the next morning, I could get up and go to work. And I thought, wow, that's really interesting. So 2 weeks later, I stopped everything again. And at 36 hours, I couldn't function. And I waited 3 days, and then I took my supplements again, and I could go back to work. So I was still exhausted, but I could function. And so now I'm thrilled. I'm like, I think I'm figuring out stuff that my physicians don't know. And I talked to my primary care doc. She was intrigued and said, "Okay, well, this is interesting." And so now I am really fired up about reading the scientific literature. My boss had me join the Institutional Review Board, which is the committee that reviews research. And so I told that board that I really would like to assign me all the studies related to the brain. So I'm getting more and more comfortable looking at the scientific studies that are going on, reading the research, and slowly adding a few more things. And then in the summer of '07, we have a remarkable sequence of things that happened. One is that my um, boss, chief of staff at the VA, calls me into his office and says, "Terry, I'm going to assign you to the traumatic brain injury clinic. You'll start in January. In about 6 months, you can wrap up everything you're doing." He describes the job. I'll be seeing patients as part of a multidisciplinary team. There'll be no residents. My spouse, when I tell her, she says, "Terry, you won't be able to do that." And I go like, "Yeah, I know." And so come January, I'll have to go to the traumatic brain injury clinic, and if I can't do the job, I'll finally have to apply for disability. So I'm upset. But I'm a farmer's kid, so I try to be stoic about all of this. And 2 weeks later, in my packet of studies to review for the Institutional Review Board is a study using electrical stimulation of muscles in people who are paralyzed, who are never going to walk again. And so I want to buy one of these devices. And Jackie says, "No, honey. But what they'll do is you'll ask Dave, you'll ask for the physical therapist that you're seeing." So I make an appointment with Dave. And he says, "Well, this is for athletes. It's really quite painful. Yes, I could probably grow more muscles for you, but I don't know that your brain could talk to the muscles. I might be making everything worse." But he gives me a test session, and it hurts a lot. I mean, it hurts like hell. But when it's
Is it
over,
like
I feel great.
okay?
And he says, "Well, it's probably the endorphins." Um, and so I go every day, and I get my little electrical stimulation session, which, by the way, I can tolerate more minutes of electrical stim than I can only do about 10 minutes of exercise. But I'm doing 30 minutes of this really painful electrical stimulation.
Is that like a tens
It's
unit or is that
well, you
different?
put it's sort of like a TENS unit, but you put the electrodes over muscles. And it causes the muscles to contract.
Yeah.
You dial it up to as much pain as you can tolerate. It begins to feel a bit better. The pain reduces after a few minutes, and then Dave turns up again and says, "No, no, we're growing muscles, Terry. We got to."
Okay.
And so it's and I'm an athlete. I get they have to be really intense, and so this is really a very intense half hour of as much pain as you can tolerate. And sort of the other thing that's remarkable is about 2 weeks, maybe 3 weeks after starting my eStim, the other thing that I discover is I'm doing my search through the internet and trolling. I discovered this organization called the Institute for Functional Medicine. And they have a course on neuroprotection, a functional medicine to common and uncommon neurological disease. And I look at their instructors, their Harvard trained physicians, and so I order the course. Yeah, and I start going through it, and uh, you know, they talk a lot about mitochondria, and so I'm really excited. This is great stuff. And I have a longer list of supplements, which I order, and I start taking them. I'm doing my electrical stimulation. I'm doing my little 10-minute workout, and then I have this aha. Yeah, and I really have to laugh at myself how long it took to have this aha. Because you see, I'd been already doing the paleo diet for about 5 years, and I'd figured that, and I'd been a vegetarian for 20 years before that. I, adopted the paleo diet, and I figure who knows how long it takes your body to heal after the damage from MS. So at least I'm doing something. Yeah, and I've added these supplements. I've added eStim, and then I had this really interesting aha. Like, what if I redesign my paleo diet based on the things I'm taking on my supplements? Figure out where they are in the food supply based on a paleo diet. So that's a few more months of research. So now I have a very structured paleo diet. And I start the other thing that I did that's super interesting. Over the summer, I'd done food sensitivity testing, and I saw that one of my sensitive issues was eggs. So I took eggs out. And I have this new way of very structured eating, December 26, 2007. Now, for context, I'm so weak I can no longer sit up. I have a zero gravity chair that I lean back with my knees higher than my nose. That's how I staff the resident clinic. And that's how I'm taking my meals at home. I can take a few steps with two walking sticks. I'm beginning to have issues with brain fog, which is probably why my chief of staff reassigned me, because he was forcing me into a job that he knew I probably couldn't take, and I'd probably have to take medical disability. My trigeminal neuralgia was more and more difficult to turn off. And so I knew my future was becoming bedridden by my illness, probably demented by my illness, and probably have the trigeminal turn on, not turn off, and die with intractable pain. So, I mean, this is a very, very grim future. And then I also know that come January 1, I'm going to go to this new job staffing the traumatic brain injury clinic that I probably won't be able to do, and I'll probably have to take medical disability finally. To slow my decline, because my father had mononeuritis multiplex, had a terrible, terrible, progressively severe pain. It's very clear to me I had a progressive illness. My trigeminal neuralgia had been getting worse for 27 years. My MS had been getting relentlessly worse for 7 years. My physicians, and I knew that if you have secondary progressive MS, functions once lost never come back. So and my hand still worked. So I'm doing all that I can to keep my hands. I have no expectation I'm going to be walking again. I know I'm probably going to be having to take medical disability shortly. So I start this new way of eating. January comes, a few days later. I have to go to the traumatic brain injury clinic. In the first 2 weeks, I just watch my new partners. Like, I should be able to do that. The third week of January, I start. And so on Monday, I see my first round of patients. I do the exams. I write the notes. And I can stand up briefly, so I do my exam, sit back down, write my notes. I come home Monday. I said, honey, that wasn't too bad. I'd like to try eating at the table with the rest of you in a regular chair. Now, that's a really big deal. I haven't done that in years. And that goes okay. And then the next week, when I am seeing my physical therapist, he said, Terry, you're getting stronger. Let's have you do your workouts twice a day. So 10 minutes twice a day. then fit.
And so how soon from you noticing these small baby
You
steps of
know,
improvement
so I'd
until
started the
feeling
electrical
better?
stimulation August 1, um, and I really hadn't noticed much. I started this new wave eating, December 26th. Very structured paleo diet. And I'd say it's about 3 weeks later that I can sit up a little bit better. And so I'm sitting in a regular chair, first time in years, for supper. And then at the end of January, my physical therapist says, you're definitely stronger. We're going to have you start exercising twice a day. And then, I'm like, and he says, Terry, um, when I started doing the electrical stimulation, he got me a home device, and I'm doing it more. He says 15 minutes is what we do for athletes to maintain muscle mass. 45 minutes, when you do volitional contraction at the same time you're doing your electrical stimulation, you can build more muscle. And you're weak everywhere, Terry. So however however you can get this into your day, you can stimulate as much as you want. So I'm like, well, I'm still working. I got to figure out how to do this while at work. So I start taking my device to work. I'm putting on my electrodes. And if I'm in my office, I crank it up to as much pain as I can tolerate. I'm sweating from the pain. If I'm staffing resident clinic or staffing or doing the traumatic brain injury clinic, I have to dial the current back enough so I can talk. So people, because if I'm not seeing one, I'll turn up like,
It's very intense.
I
Yeah.
really can't function because
Yeah.
because I don't know how long I'm going to get the device. I I don't want to leave anything on the table, so I
Yeah. And so just to jump in, based off of the experience that you described up until now, just for the sake of time a little bit, because I know you don't have a lot of time left. You do the stimulation, you're doing a little bit of exercise, you change your diet pretty well. Like you added in meats, you said you're a vegetarian, you had gone through the supplements as well, and then you received the improvement over time. You started to
yeah.
improve and gained function back. What what's the protocol like? How has that experience shaped the advice that you now give to
You
patients?
know, um, what I saw is there's a lot that we can do if you start maximizing your diet, your exercise. I'd gone back to meditation, and I began teaching these concepts uh, in the traumatic brain injury clinic, where people would say, my partner is all saying, there's nothing we can do. You're gonna come back or not. And I started saying, well, there's a lot you can do. Let's work on your diet. Let's get a step counter and start paying attention to sleep. And you could tell that, I'm clearly getting better. I'm beginning to walk again for the first time. And I am talking to my patients that, yes, work on your diet. And I started advocating for the paleo diet. And we could tell that my traumatic brain injury clinics, people are doing better. And in primary care, I am remarkably successful at getting these cantankerous veterinary veterans to actually begin improving their diet and to begin. And I was just really basic: get a step counter and count your steps, and do more steps each week. And my patients actually followed my advice. They improved their diets. They began exercising, and people started seeing diabetes reverse, high blood pressure reverse, moods improve, chronic pain reduce, my traumatic brain injury vets. Also, you could tell who I saw because they started improving. They still had their jobs. They still had their romantic partners. And then the other thing that happened that was remarkable is I had gone to my local organic grocer and I said, I'd sort of like to start giving talks about my experience. And it was to packed audiences because, I'm talking about how I had been in a wheelchair and now I'm walking and biking and fully functional. And so every time I went to give a public lecture, they kept having to move to larger and larger venues because we had more and more people in the audience. And then there was the day that I wanted to ride my bike again for the first time in 6 years. And we had this emergency family meeting, and I got on my bike, and my spouse said to my 16-year-old son, Zach, you went alongside on the left, and to my 13-year-old daughter, you went on the right, and she followed. And I biked around the block. And of course, my kids are crying, Jackie's crying, and I'm crying. And that's the day when I realized who knows how much recovery I could have. Because up until then, I didn't know what my improvement meant. Because if you have a progressive neurologic disease, you let go of the future. And now I could how much recovery is possible. And that's when I really changed how I practice medicine. I started teaching the public. And, since then, I've made it my mission to do this research, investigating diet and lifestyle in the setting of multiple sclerosis. I teach clinicians and I teach the public that whatever your medical condition, there are things that you can do with your diet and your lifestyle that can slow the disease and often lead to
Yeah.
remarkable improvement.
And so, what are those practical steps of the changes that somebody could take away today, even any physicians listening?
Yes.
And then the other thing I want you to touch on is you said you have really good skills at kind of convincing people to make those lifestyle
Yeah.
changes.
Yeah.
So practical, and then how do
How
you
do you get
have
people to
those
make these big changes?
conversations?
So
Yeah.
the three most common allergens that people can have an abnormal immune response: gluten-containing grains, dairy, and it's the protein in dairy, and eggs. So you take those three food groups out, and you replace them with these radical things known as vegetables and meat. If you're a vegetarian, you're going to need gluten-free grains and legumes. My preference is meat because then you have a complete amino acid. But I realize some people are vegetarian for religious and personal reasons, so we do have vegetarian options. And then we talk about exercise, and I start with step counters or whatever exercise I can have the person do. And then, why do people want to do this? So in my clinics, I like to very simple question: if your house was burning, who or what do you care about so much that you'd run into the house to go save, barefoot over broken glass? And usually it's a person, a spouse, children, grandchildren. Occasionally it's a parent, and occasionally it's a cat or dog. And now the next question is, what would you like to do if your health could improve a little bit that you can't do now? Now I have a reason to do the work. And I admit this is hard. It's hard to give up this delicious food. Um, but could we have an experiment where you do this and I prefer 3 months, but we'll negotiate how long. Sometimes it's as short as 2 weeks. And the veteran would pick the start date and write out the goal of what they want to be doing and how long their experiment's going to be. And I admit this is hard. And my veterans could do this. And because I could talk about my experience, how it transformed my life, and man, I'd have to do, because I was staffing resident clinic, I'd have to do this in about 5 minutes. In my traumatic brain injury
Okay.
clinic, I have to do this in 20 minutes. But you
It's
can.
not a lot of time.
You can if you're speaking from your experience, from your heart. I was remarkably effective, and my residents were like, they couldn't wait to bring me into the most difficult cases because I was so successful at getting these veterans inspired to have hope. Say like,
Hmm.
you've been struggling with your fibromyalgia, you've been struggling with your anxiety, your depression, you've been struggling with your severe pain. Are you ready to try an experiment of changing your diet for a couple months or for a couple weeks?
Hmm.
And I'd say about 90% of my vets were like, okay, I'll give it I'll try this. And we'd see diabetes reverse, high blood pressure improve, severe PTSD improve, my traumatic brain injury clinic people would improve, people with chronic pain would improve. And then the chief of medicine at the VA called me into his office. And he said, Terry, I'm taking you out of primary care. And I knew this was going to be happening because the residents, when they'd come staff, they'd either staff with my partner in the clinic, and it was a traditional internal medicine approach, where they'd come to me and I'd talk about biochemistry, and then I was talking about broccoli and turmeric, and then we would go see their patients, and we were reversing their diseases when they had staff with me, and I figured they would not be tolerable to keep me in primary care. So I was not surprised when they said, we're pulling you out of primary care. The next sentence stunned me, said, because I want you to have your own clinic, Terry. And so we established the clinic that would be the therapeutic lifestyle clinic. And I would go to the pain clinic and to special primary care, and I say, give me your hardest patients, people you can't help, and tell them that I'm not doing drugs. This is diet and lifestyle. We got a handful of folks with remarkable success. Then we got more through the word of mouth and more. And I kept having to reimagine how I ran that clinic because I didn't want people to have to wait 6 months to see me.
Yeah. And what was the portion size that you would recommend for them to eat
Ah,
with like the
so
the diet?
so I don't want people to be hungry. So it was 9 cups of vegetables, and 3 cups of greens, 3 cups of cabbage, onion, mushroom family, 3 cups of brightly colored. And I preferred meat, but I did have a few vegetarians. And after they had their 9 cups of vegetables, they work on their protein sources. So again, I don't want people to be hungry. And we sort of laughed. My vets would say, "Now, Doc, is that per week or month?" And I said, "No, no, no.
That's a
That's
lot
per
of
day, my
vegetables.
friend. That's per day." And so basically, what you're eating is vegetables and protein. I'm
Yeah.
not wanting to have grains. I've taken grains away from you. I've taken dairy away from you. I've taken eggs away. So eat
Did you put
vegetables
them
and
in
meat
ketosis?
until you're full,
Yeah.
basically. And I'm trying to get more green leafy vegetables, more the sulfur rich, and more of the color. In my therapeutic lifestyle clinic, we had a dietitian, and we would prepare. We brought the little portable kitchen, and we would make a green smoothie with. So I'd pass around kale. Everyone to eat raw. We'd all agree it's bitter, it's terrible, it's awful. No way in hell you can eat that stuff. It's so bad, Doc. And then I'd make a green smoothie with the kale, ice, olive oil, and green grapes, and pass that around. They're like, "Well, that's pretty good. I could tolerate that." Then we'd make bacon and greens, and if we had vegetarians, then we'd use ghee or coconut oil, and we'd have greens and mushrooms. And they'd realize, my God, that's actually quite good, Doc. And my basic recipe was, if you eat meat and you eat bacon, you fry up bacon to your desired level of doneness, take the bacon out, put in the chopped kale, stir it for a minute or two, add the bacon back, and eat that. And if it's not delicious, double the bacon and try again. And and my vets were like, "Oh my God, that really is quite good." Because you can't ask people to eat stuff that tastes terrible. You have to teach them how
Yeah.
to make food so it is delicious.
Hmm. So, we talked a little bit about diet, and for the listeners, you've been on so many other podcasts, and you've given great advice, and you have a lot of resources online, so they can get more specifics around that. One of the questions that I was interested in is, what are your thoughts about like any synthetic chemicals in our
Oh,
diet or
sure.
environment affecting
The
our microbiome or
Yeah.
mitochondria?
So the processed food has a lot of additional chemicals for flavor, shelf stability that interfere with our microbiome. And now, mind you, when I was teaching people how to implement what I call the Wahls Protocol, there was not a lot of research about the microbiome. But I said, don't get the processed food. That's expensive. Don't get gluten free stuff. That's expensive. Get vegetables. And if you're a meat eater, eat vegetables and meat. If you're not a meat eater, we're going to have to do some legumes and grains. But don't buy processed foods. Get the basic ingredients. So we'd have little cooking classes for them. Now that we know more about the microbiome, we realize that all these food additives for shelf stability interfere with your microbiome. And they create uh, compounds that if they're killing the microbiome, disrupting who's going to be growing, and if they are small enough to get into your bloodstream, they're interfering with your chemistry of how life should happen. We have this crazy notion that you can create chemicals, introduce them into our environment, into our food supply. It's not until we have someone who proves that that chemical is associated with higher death rates or illness that the chemical may be removed. We don't have to prove safety. We don't have to prove safety.
Yeah,
In Europe, you have to prove safety. In America, you wait till we start killing people. Then you say, well, maybe that chemical is a problem.
yeah. Any do you have issues with the glyphosate?
Yes. Well, glyphosate originally is an antibiotic. It's a very potent antibiotic. It is killing the microbiome of our soils. It is reducing the mineral content of our food. And it is applied to grains to have all of the grains ripe at the same stage. You can get about 10% more grain when it's harvest. So we have glyphosate in our food supply, which is changing the microbiome of the livestock that we're feeding and changing the microbiome that we're eating. It is definitely a problem.
Right. And in your studies, what are do you have any thoughts about EMFs? Does that worry you at all? And
So
then,
in my clinical
yeah,
research, I don't have any EMF studies. Certainly, for some people, EMF adds to disruption and is a problem. It's not universal, but if you have a chronic disease, it is so beneficial to turn the EM off at night so you have some breaks from it.
okay. And have you come across anything about light exposure, like being out in the sunlight, optimizing your mitochondrial health?
So you certainly want to have daylight exposure. It is very, very helpful. You'd like to have near infrared light exposure. Artificial light, blue light is a problem. Uh, Not having daylight early in the day is a problem. Having artificial light in the evening, late into the night, is a problem. Our phones are a problem. Screens are a problem. We evolved millions of years in daylight. When we came inside away from daylight, that becomes a problem. Yes.
Yeah. What I've started to recommend to my patients very briefly is try to see the sunrise, see the sunset, try to walk, as much as you can throughout the day and eat your vegetables and eat your meats, avoid the crappy
Yeah.
carbs. And that's kind of like my spiel in less than 5 minutes at the very end.
Yeah. And I explained that we evolved outside, eating vegetables, meat, exercise, and sleeping at night. And the more we move away from that, the worse our health becomes. So, and also talk about making small incremental steps, but bit by bit that you can do. If you are ready to do a radical overhaul of your life, you can. But it's easier if we do it one achievable step at a time. Uh, and at the pace that you and your family can accommodate. It's far easier if you will make changes as a family. I'm going to add these foods, we'll reduce and eliminate these foods as a family. And then you'll be successful.
Right. Okay. And what advice do you usually give practitioners in being able to discuss the diet and lifestyle changes with
Well,
their patients?
we have a practitioner training program, so we talk about all these various interventions, and we talk about, and I teach the Wahls behavior change model. In short, you have to have an inspiration, cases of recovery that you can talk about. Then you have to explain the mechanisms briefly, and then you need to have small achievable steps. And I want to acknowledge that we're asking people to do things that are hard, very hard to create new habits, extinguish bad habits. So I acknowledge that it's hard, and then we have to create a reason why. So that's how I talk about the house on fire. Who would you save, and what would you like to be doing with that person? And now I have a reason to endure discomfort because we will endure tremendous pain to save someone I love. Absolutely, no problem. That's what humans do. We will endure great pain to save someone we love. Now that I have a reason to endure the discomfort of giving up uh, other addictions, giving up foods that I love, exercising every day, I have to have a reason to endure that discomfort. And if I don't have a reason, then you need to send the person to talk therapists so they have purpose and meaning in their life. And then
Yeah.
they can endure discomfort to make these changes.
Yeah, it's so important to be able to endure those challenges to make lasting changes and lifestyle changes, right? It's not just
Absolutely.
a diet.
Because biologically, my brain is wired to avoid pain and seek comfort.
Yeah.
If I don't give a person a reason to endure the pain and discomfort of extinguishing the bad habits and creating new habits, they cannot do it.
Okay. Are there other autoimmune conditions that you've seen improve or
Sure,
reverse?
lupus, fibromyalgia, psoriasis, um, inflammatory bowel disease, severe anxiety, PTSD, early Parkinson's, cognitive decline, brain fog, and now, of course, the long COVID. So, and what's wild is every week we get contacts from people all around the globe who've discovered my work, who are reaching out to say, I have condition X. My physician said they had nothing more to offer. I've discovered your work, and I'm getting better. And so I have to look up condition X. There are a variety of autoimmune diseases I didn't know about, so I'm learning about that. And now it's a variety of genetic diseases that people are getting better from. It's not that their genetic problem has gone away, but their function is remarkably better. Their quality of life is remarkably better.
What that's one of the cool things is that a part that is part of that diet is that it improves mitochondrial health,
Yes,
and it research is more and more showing that mitochondrial dysfunction is at the root of a lot of our metabolic or our health conditions.
absolutely.
And
Mitochondrial
so,
function, we rely on the mitochondria to power the energy for our cells. And when your mitochondria can't work, it shows up as fatigue, brain fog, heart failure, and then other disease entities as part of obesity, part of type 2 diabetes, part of chronic pain, part of brain fog, part of anxiety, depression, irritability. And as I help people get their mitochondria working better, because they have to stop poisoning it. That's where going organic, getting rid of glyphosate really helps. Then you nourishment, better nutrition, and B vitamins. Really basic stuff can have a really big help. And then, of course, I have a more complex supplement program as well. It is remarkable. People whose physicians have said there's nothing more I can do, they come see me. They're getting better and better. And they're sometimes their physicians get on board like, oh my God, what are you doing? Tell me all about it. And sometimes the physician just can't comprehend what's happening. and they get nervous because the blood sugars are going down, they're getting better, their blood pressures are going down, and they feel like we're creating harm. And I'm like, no, 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 you just have to reduce your antihypertensives, you have to reduce your your diabetic meds, because everything is working better. You have less dysfunction. You need lower doses of your prescription meds.
Great. And so, in summary, basically, a takeaway point for everybody here is just improve your diet, eat what it grows in nature, eat your
Mhm.
veggies, eat your meat. Don't be afraid of either. I know a lot of listeners are either on the carnivore side or the other extreme side, and so we can pick sides. But it's good to have that metabolic also
Yeah.
flexibility. I know you talked about that in previous podcasts. Get some sunlight,
Sleep.
exercise, get your sleep, which is huge. Try to optimize your circadian rhythm. There's a lot of research there about
Yeah.
circadian rhythm impacting our health. Did you want to say something
You know,
about that?
the more we can get our life aligned with what our ancestors did 20,000 years ago, the better we'll do. And so when the sun goes down, try to go to bed. When the sun goes up, try and get up. And the closer you can match that, the better you'll be. Be really careful about your daylight. Be really careful about your artificial light. And the more closely you can align that to the daylight hours that you see, the better you'll do. Melatonin can be helpful. Um, Taking care of your light will be even more helpful than the melatonin.
Yeah, because you generate your own melatonin. So if you're always in blue light,
It's very
you're
hard to
not going to be
generate.
releasing as much. Yeah. And so we've talked about quite a bit, and I know you have another podcast to go to. Briefly, is there any kind of research that you've been
Yeah. So
doing, any interesting results,
um,
and then where can people find you?
we've done 7 studies, published them all. I consistently find if you implement diet and lifestyle, fatigue goes down, quality of life improves, motor function improves. I'm doing another study right now comparing a ketogenic diet, paleo diet to usual diet for people with relapsing remitting multiple sclerosis. You have to come to Iowa month 0, month 3, month 24. We are still recruiting. And so, listeners, please go to terrywalls.com/MS study. Screen, you can say you want to be part of our database for other future studies. If you're willing to come to Iowa and willing to be randomized, you can tell us that you'd like to be part of my current study. Again, for relapsing remitting multiple sclerosis, you have to be willing to be randomized. You can be on any therapeutic diet now, that's fine, as long as you're willing to be randomized, such that if you're randomized to the keto diet, you'll do keto. If you're randomized to the paleo diet, you'll do paleo. If you're on the usual diet, you get to keep eating what you're doing. Go to terrywalls.com/MS study to register for our patient registry and to tell us that you're interested in this clinical trial. So I want everyone to screen so you can be a part of our patient registry. And if you're willing to come to Iowa and you have relapsing remitting MS, and then we could get you in my current study. And I'll probably be enrolling, I'm guessing, through the month of July. Um, we, again, be part of our patient registry because we do some survey based studies only from time to time, so you could hear about those. Uh, and Follow me on Instagram, Dr. Terry Walls. You get to see what I'm eating and doing. It's lots of fun. We have a website, terrywalls.com. Sign up for an email, and you'll get information about the latest research, my review of research that's out there. It's very exciting stuff.
Great. Thank you so much for your time. And it's great that you have so many resources online for people to learn for free, or if they want to pay for more in depth knowledge, that's also accessible to them. Any last words?
There's always stuff that you can do. Whatever your health condition, there are things that you can do that will either accelerate your disease or make it possible to heal and have greater function. There's stuff under your control. Be sure to begin that journey.
Never give up. Well, thank you very much. And I hope you have a great day.
Thank you. Bye bye now.